My name is Nicole Paradise Black, and I am the Associate Chair of Education for the Department of Pediatrics and the Program Director for the Pediatric Residency program. So the consortium started with 6 residency programs in 2015 that were interested in pulling their data on residency burnout and understanding resiliency in pediatric residency. That program, or the group, quickly grew such that now in 2018 we have over 53 programs that are working to understand burnout and resiliency in residency. So that's over 25% of the residency programs in the country in pediatrics. So we are working together in order to do a yearly survey on pediatric residents on all different domains related to burnout and resiliency, so we can understand the epidemiology of burnout, and then also understand sort of the natural history of burnout and understand ways that residents can improve upon the resilience during residency. So the true goal initially is to have the yearly survey so that we can first understand again the epidemiology of burnout and its natural history, but then to move forward with that information so that we can ultimately devise interventions so that we can mitigate and decrease burnout in residency and then improve upon resiliency so that ultimately we can have pediatric physicians who are happy and compassionate and who are well and can carry that well into their future careers. Our true vision for the consortium is to have to be a member-run organization that are true leaders in graduate medical education, who can again run these studies, provide a collaborative platform where we can design studies to again understand burnout, to understand resilience, and then provide means of understanding true interventions that can work so that we can provide evidence-based interventions for not only pediatric residents but for residents across the nations and across specialties. So medicine is a really rewarding field. It's also a very demanding field. It's physically demanding, it's emotionally demanding, it's intellectually demanding. We promise when we go into this field that we're going to put our patients above ourselves, but it shouldn't be at a cost to ourselves. And so we have to figure out a way to find a good balance where we can do everything that we promise that we're going to do in this field and in our jobs, but also make sure that we remain whole as people. As a residency director, I have been thinking a lot about this topic of wellness and being the whole physician and being a whole person. And there's a lot of change that needs to happen on a systems level, and that's going to take some time. And so one of the main areas that I've been focusing on personally as a program director is building community. I think we've taken a lot of the pressure of residency off by doing these fun activities with the residents, and I've personally enjoyed the stuff that we've done, and so I look forward to doing more things related to community. And I think it brings a lot of the human quality of medicine and what we do back into our residency program. So I'm really proud of that.